Okay, looks like we are
Are we
live.
live? We are live. Hi, everyone. It's Geri White from Hudson Valley Physical Therapy.
Hey, I'm Zazu Cioce, orthopedic and pelvic health physical therapist. There we go. That's my phone. Watching us. And we're here to do our Mythbusting Monday.
Absolutely. So today we are going to be talking about or busting the myth of male pelvic pain. And Zazu, can you share your PowerPoint with me?
So I am sharing.
You are.
Right now.
So where is it? So please hold. Let me just see where I am. The myth of male pelvic pain. And Zazu, can you share your... Okay, here we are. So sorry about that. Okay, so the first myth that we want to bust is men don't have pelvic floor muscles. And basically they do. So as you can see in these beautifully illustrated slides that we have on our PowerPoint, are the photos of the male pelvic floor. So on the top left, you can see there is everything below the shaft of the penis here, and also along the shaft of the penis is our pelvic floor muscles. So as in females, males do have pelvic floor muscles and 3 layers of pelvic floor muscles, just like the females, going from front to back. On this slide here, the lateral view on the top right, you will see the pubic bone at the front. Then you've got the bladder just above it. And then behind is the tailbone. And then just in front of that tailbone area is your rectum. So your male pelvic floor, or your pelvic floor muscles in a male, go from front to back. So pubic bone to tailbone. And then fanning out towards the side. And then, as you can see there, and then at the very bottom photo, if you could see that, is also the pelvic floor muscles just from the top view. It's really the deep layer of pelvic floor muscles. Layer 3 is what we call it. And it's everything in that pinky kind of reddish color that goes from front to back. It surrounds each opening in terms of the urethra and then the anus, and then attaches to the tailbone, one part of it, and then fans out to the side. So the male pelvic floor functions the same way as the female pelvic floor. So sphincteric, supportive, sphincteric meaning bladder and bowel control, supportive in nature meaning supporting all the organs above it in the abdomen, as you see there, the bladder, the rectum, and then the digestive or intestinal contents. And then also a sump pump, where it helps to pump the blood vessel, the blood flow back from the lower extremities up towards the heart. So males do have a pelvic floor. And again, functioning very similar to the female pelvic floor.
Yeah, and what I'd also say is that they also have sexual function, like in females, and they also work with stability, as you can see in the bottom picture here. All of the attachments into the bottom part of the pelvis really help to stabilize the actual pelvic joints and the pelvis bony structures themselves. So yeah, myth busted on that one. And we've got a few more. So it's just something that, and these are all things that we hear like fairly commonly, that, you know, men don't have pelvic floors, or like, I don't need to worry about that if I'm a guy, but you do. And if your pelvic floor isn't working, just like as in people who have a vagina, then you will also have problems in any or all of those areas that both Geri and I mentioned of those functions of the pelvic floor. So that kind of leads me into the next myth, which is men wouldn't benefit from Kegels. So again, just like with anybody else who has pelvic floor muscles, which is all humans, you need to have strength in those muscles. And so if you are weaker in that muscle group, then you can start to have some issues with just pelvic functioning in general, which again, we talked about, sexual, stability, sump pump, which is that, pumping of the fluids, and sphincteric, closing all of the holes, all of that good stuff. So if your pelvic floor muscles are weak, then you would benefit from Kegels. Now, a lot of the cues that we talk about with Kegels are very female centered, in the sense that sometimes we will say, okay, it's like, picking up a marble with your vagina. Well, if you don't have a vagina, then that cue isn't really going to make sense or work for you. So other kind of like general cues that we give would be like as if you were trying to stop the flow of urine. And so you're just trying to use those small muscles. Another general cue would be like if you're trying to stop the flow of gas. So you're in a busy elevator with whatever celebrity you have like a celebrity crush on, and you have to fart, and you're trying to keep your gas in so that you do not make them run out of the elevator. So it's a cue like that. And then something specific that I will sometimes use for males very specifically is kind of to imagine that you are walking into the ocean, and there are waves coming at you as you're walking into the ocean. The water starts to kind of come up in, from your feet all the way up towards your torso, and the water's really cold. So as the water level gets closer to your actual, genitals, what do? You try to kind of like lift up and try to stay away from that cold water, and then kind of relax back down. So that's a specific cue that I will kind of tend to use with males. Do you have any other specific ones for males, Geri, that you use?
Just in terms of activating the Kegels, no, those are very good cues. So the other thing that I also have them learn is making sure they are doing a Kegel during the exhale component. So a lot of us, males and females and everybody else included, will perform a Kegel by holding their breath. So just making sure that when you are Kegeling, that you are actually exhaling while you are activating your pelvic floor.
Yeah, definitely. And the exhale is really helpful because, right, the diaphragm works with our pelvic floor muscles. So when you exhale, the diaphragm is actually kind of helping you to be able to do your Kegel a little bit better. But yeah, it's important to be able to do them in all sorts of different ways. But if your go-to is just holding your breath, we got to build that capacity up for sure. Whether you're a male or a female or anything else that you identify as. Exactly. So right. Okay. So then the next one, go ahead and go for the next one.
Okay. So busting this myth number 3, if men have pain down there, it must be coming from their back. So as you can see from these anatomical illustrations, there are a lot of structures down there. In the pelvic region, as well as the back region, that could be contributing to your pain down there. Now, what we mean down there in quotes, it could be anything, right? It could be genital pain. It could be pain at the, what we call perineum, between the base of the penis and the rectum. It could be tailbone pain. So pain down there, as you can see from these illustrations, could be coming from a variety of different structures. So certainly, yes, the back, but you got to think about if nothing else if your back has been ruled out in terms of diagnostics, x-rays, CAT scans, MRIs, nothing else going on in the back, then really look at other structures. So it could be the pelvic floor, it could be the hip area, because the hip joint is very closely located to the pelvic floor muscles. And actually there is one muscle, the obturator internus, which is a hip rotator that actually functions with the pelvic floor muscles. So you want to make sure that gets looked at as well. That could be a contributing factor to your pelvic pain or pain down there. Other areas could be your inguinal or groin region, right? So very closely related to the pelvic floor muscles. The fascia from the inguinal and groin contents are anatomically connected to the fascia at the pelvic floor. So just making sure that's also checked out. And so if all of these other structures have been deemed negative in terms of diagnostics from your physician, then you need to think about musculoskeletal. So meaning looking at the muscles in the pelvic floor and how they actually are influencing your skeletal posture or positioning, which might be causing you pain down there. So a lot of things to think about. But again, if everything else has been diagnostically tested and there's nothing else going on, then time for you to get to go to a pelvic health PT who really knows the muscles down there and to see what could be contributing to your symptoms.
Yeah, definitely. And I would also add to that, as far as, what you had said is you get all these diagnostic tests and everything's coming clean from, all these other areas. Yeah, you definitely need to start thinking about, what are some less common areas that people will usually kind of give you as a possibility. And the pelvic floor does tend to be one of those areas that gets overlooked a lot. But it would make a lot of sense that if you're having pain, in the genital area, on your actual genitals, on your actual penis, not even, just the area around, but if you're having that type of pain, that it's important to be able to, one, rule out, other stuff that might be going on, but two, once that gets ruled out, like, okay, let's look at the muscles and let's also look at the nerves and see if there is some nerve irritability, if there is some other type of pain processes that are going on that need to get evaluated and treated for you to be able to feel better consistently.
Right. Good.
All right. So our next one is you can't injure your pelvic floor during sports. So, this should be kind of like an obvious myth because really I feel like you could injure anything when you're playing sports, especially depending on the sport that you're playing. But this is something that we hear and kind of experience with, I would say, like a good amount of at least the males that I have worked with, that it all started basically from a sport accident or a sport injury. And so what are the main things that we kind of go to with a sport accident or a sport injury that are down in the pelvis is most of the times we think like hamstring strain, or, again, like back issue, like herniated disc or something like that. But oftentimes, remember, like all of those muscles work together. So the pelvic floor, your abdominals, your deep back muscles, and your diaphragm, they all create your core. And so if you're having, issues in one area, or if you're having an area that isn't as optimized as others, then that creates an opportunity for possible injury. And if you're a very active person, then what comes with being active, the joys of being active also come with the risks of being active, right? But that's living life. And so we've seen plenty of people where, it's a sporting accident and now all of a sudden they have pain in their pelvis, or they have pain in their penis, or they have pain during sex, all sorts of different types of contexts and situations, but all stemming from more of a sport related injury that really had like nothing to do with their pelvic floor, as far as the injury itself, but stemmed into the pelvic floor because the pelvic floor works with all of our body.
Right, exactly. Yep, good. Okay, so myth number 5. If you have pelvic pain, it's because you have prostatitis. So just from our experience clinically, the patients who come in, the male patients who come in to our practice with complaints of pelvic pain have had a history of pelvic pain. So they've been to their provider or practitioner and have been prescribed multiple doses of antibiotics, thinking that it is a prostatitis type of issue with bladder pain, bladder or urinary urgency frequency. And then it becomes a more of a pain issue. So what happens is with the antibiotics, they get better. Their pain actually resolves. So they go to live their life, but then the pain comes back again. And then what happens again? Then they get prescribed another dose or another series of antibiotics, and on and on. So it could be this cycle of pelvic pain / bladder pain. They get diagnosed as prostatitis. Then they get prescribed antibiotics. They get better for, it could be 2 weeks, it could be a couple of months, then it comes back. So it's cyclical, and to the point where the antibiotics don't work anymore in terms of really controlling their pain. And initially it could be that they actually had a prostatitis inflammation, bacterial type of infection. That's what then responded to the antibiotics. But then what happens is, by the time we see the patients or males who come in with pelvic pain, who've had a long history of pelvic pain, there's actually no more bacteria. There's no more infection. That's why the antibiotics are no longer working. It becomes more of an inflammatory type of condition where it's causing pain to the pelvic area as well to the bladder area, but no infection. So if you've been prescribed multiple doses of antibiotics, and initially again it has helped in the first couple of bouts, but then as time goes on, didn't really help, then maybe it's time for you to have a talk with your provider and really discuss what exactly other things that they can be looking at causing your pelvic pain. And then by the time they come to see us, it could be, you know, they've been through several courses of antibiotics. They've seen multiple specialists. Up to 7 is really the average, is what we've seen in research, that that no one knows what else to do with them. So finally they said, well, try pelvic floor, and then it actually ends up being a hyperactive, overly active pelvic floor muscle system. So that's where we come in. But again, if you have been experiencing a long history of chronic pelvic pain, and the only type of treatment you've had is antibiotics, which are no longer helping, then it's time to talk to your provider to find out and investigate what other causes could be, where it could be coming from.
Yeah, for sure. And just even, you know, some research shows that nearly 1/3 or 35 to 50% of men will experience symptoms of chronic pelvic pain syndrome / chronic prostatitis at some point during their life. So it's something that is like fairly prevalent at some point during your life. And I think something kind of moving into the next myth is that pain with sex does not need to be addressed. Yes, it does. So not only just because of, you know, what could be causing it could potentially be improved and be optimized so that you're not having pain with sex anymore, and you're able to enjoy that time with your partner. But also it kind of brings up another concept or issue or thing that we see commonly, which is that, you know, guys, a lot of the guys that we see, they haven't really talked to anybody about their issue. And a lot of times from what we've heard is that they don't know who to talk to, or they don't feel comfortable talking to like their partner about it. They don't feel comfortable talking to their male friends about it, like to ask like, hey, are you guys also experiencing something like this? Or have you ever experienced something like this? And so it tends to be male pelvic pain in general. And I honestly, even other male pelvic symptoms of like incontinence or like leaking and, you know, other types of stuff, like tend to not be things that are very openly talked about or even like brought to the attention of that person's friends, close friends or family, or even providers sometimes. Sometimes even when they get to the point where they're here with us, it still takes a good amount of time and direct questioning to get them to express like truly what has been going on with them. And that, you know, could be for several different reasons. Obviously, it's an embarrassing topic just in general. A lot of people are uncomfortable talking about, right, their pelvises, their genitals, their sexual experiences. But it's key to remember that like we're here to help, and we see these things every day. And so you're not alone. There are lots of people who have similar issues, and there are things that we can do to improve your quality of life so that you can live your life to the fullest. And there are some things that you don't necessarily have to live with if you give some other treatments a try. So yeah, so pain with sex, it does need to be addressed. It doesn't just happen in females, it happens in males too. And we see it fairly often for several different reasons. And that means there's lots of different types of treatment things that we can do to try to optimize that.
Exactly. I mean, we could spend a whole hour talking on about pain with sex as well as male pelvic pain. So we just wanted to hop on here real quick today and just really try to bust these myths. If you have any questions, if you want to reach out to us, our emails are here. And regarding your case, or what you think we can do to help you, we are here for you. So, or you can instant message us and reach out or give us a call or email us. We're here. And we'll be back next Monday for another topic. We are going to focus June on male pelvic health as well as Pride Month. So, so be on the lookout for our next Myth Busting Monday next week.
That's right. Next week, I think we are going to go over male urinary leakage.
Right.
So if that's something you're interested in or have a problem with, tune in.
Tune in. Right. See you then. Bye.
All right. Bye, guys.